Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate as of September 1st, 2022. This week, I'm going to update two topics that we've been talking about for quite a while. What is the latest information about COVID-19, and what is the latest information about monkeypox? In terms of COVID-19, globally, we were watching what looked like we might be starting another spike. As it turns out, we haven't been. So the numbers appear to be coming down, but already 6.5 million deaths. In the US, we're seeing this different pattern. What we've seen is now for the last 5 months, there's been no spike at all and just a continuous steady number of deaths. Now, this is a good news, bad news story. The good news is there hasn't been a spike with thousands of daily deaths. The bad news is we've had 5 months of 300 to 500, mostly 350 to 450 deaths every day. So COVID remains one of the top 7 causes of death in our country. So while it isn't getting worse, it's also not going away. We've had over a million deaths nationwide. When you look at where the cases are today, you see this dark area right here in central Appalachia. And what's interesting to me is if you go back a month ago, it was pretty much the same pattern. So again, not a lot of spread, but a steady, consistent number of deaths, and perhaps concentrated in some of the poorer parts of the country. Now, the big news, of course, this week was that Fda authorized a new booster, what they call a bivalent booster. That means it has components of the original strain of SARS-CoV-2, the virus that causes COVID-19, and some components of the BA4 and BA5 subvariants of Omicron. So it has both bivalent. It's authorized for use as a single booster in folks 18 and older, that's the Moderna, and for Pfizer 12 and older. Now, as we are recording this, the Advisory Committee on Immunization Practices at the CDC is meeting to discuss what recommendations they will have, whether they'll agree with the FDA or not. Remember, the FDA approves a vaccine saying it is safe and effective. The Advisory Committee on Immunization Practices provides practitioners with recommendations on how to use it. So one of the questions is, will this booster be used? And personally, this is my own thoughts now. I think there may be a slow uptake of this. And I say that for a couple of reasons. First of all, even today, among Americans who are fully vaccinated, less than half have been boosted. So these are not folks who are against being vaccinated. They're folks who are vaccinated who simply have chosen not to be vaccinated. A second reason I think there'll be lower uptake of this booster is that many folks who are fully vaccinated and in some cases boosted have developed COVID, and they think, well, if I'm not going to be protected, why bother to be boosted? And so I'm one of the people that was vaccinated and boosted and still got COVID. But what we need to understand is that most of us who got COVID after being vaccinated and boosted had a much milder disease than we might have had otherwise. And I think as long as the numbers are low, or at least the public perception of the numbers being low, there will be low uptake. Though I would remind you that 300 to 500 deaths a day is not low. So the new information is COVID continues at an oddly level number of deaths. We have a new product for booster, and we'll have to wait and see what ACIP recommends and what American public does. In terms of monkeypox, globally, over 50,000 cases have been reported from 99 countries. Overwhelmingly, almost all of them are in countries that have not historically had monkeypox. Remember, monkeypox has existed in West and Central Africa since it was discovered in the 1970s. And on this map, those blue dots there represent the countries where monkeypox has been endemic. All the other dots are in new countries that have not traditionally had monkeypox. The size of the dot shows you the number of cases. And what you can see is the US is far outstripping all other countries in terms of number of cases. We're also seeing it sort of evolve early on in the early weeks of the epidemic. It was largely in the European region. But then now the blue, the Americas, and largely the United States are taking over. In terms of deaths, there have been 14 deaths worldwide. In the United States, we have over a third of all of the total cases reported in the world. Now, again, our system of reporting is probably better than many other countries, but still it's disproportionately present here. Every state has had at least 2 cases. And you can see the case here are all the states where there are more than 100 cases reported. If you want to look up your own state, if it's not shown here, you can look at the link at the bottom. Now, earlier this week, Texas confirmed the first death of a person with monkeypox. As you saw before, 50,000 cases and 14 deaths, it's not usually fatal. But what they did say is this is a person who was severely immune compromised. In other words, this person was already very ill before they got monkeypox. And as they say, the case is under investigation to determine what role monkeypox played in deaths. Now, you'll recall that we were looking over time the number of cases per day since the outbreak began in the United States. And we were seeing this steady uptick in cases until a couple of weeks ago. And then last week, we thought maybe we were seeing it come down. But if you look at the last 4 weeks together, it looks like pretty much we're somewhere around 350 cases a day in the United States. We certainly hope it'll start coming down. And I was more optimistic last week than I am this week based on the numbers, but we'll keep our eye on it. What's particularly odd about this is this is from the Pan American Health Organization. This is all the other countries in the Americas, and you can see they were coming up more and more and more cases, and then now been coming down. And yet the U.S. continues to stay about the same. So we'll have to keep our eye on that. So the latest on COVID, a new booster, 5 months of it being somewhere in the 5th to 7th leading cause of death in our country. And in terms of monkeypox, possible death in Texas, the U.S. dominating the total number of cases worldwide with about a third of all the cases. A great deal more information about COVID, monkeypox, and other public health issues on the College of Public Health website. Please feel free to always share these videos with anyone who might be interested. If they'd like to be added to our listserv, we're happy to do that. Please contact Jan Stork as outlined here. Thanks as always to Dara Young for editing, producing, adding captions, and posting this video. And importantly, if you have any questions about any evolving public health issue, or you have questions or issues with anything that I've said in one of these updates, please let me know. I look forward to hearing from you. I'll either try to respond to you directly by email, or I'll add it to next week's update. Until next week, please be well.